Hello and welcome to this edition of Your Health, Your Wealth. I'm Dr. Eddie Patton, and today we're going to talk about the power of preventative care. And when I talk about preventative care, I'm talking about like wellness care, things that we can do ourselves to help impact our long-term health care and hopefully reduce the amount of time, effort, and finances that we use in healthcare spending, rather. So one of Benjamin Franklin's most famous sayings is, "An ounce of prevention is worth a pound of cure." And whether you're talking about finances or business or anything else, this statement is very applicable to healthcare as well. When we think about primary prevention, we're talking about things that we can do to help to prevent a disease from happening. One example would be like the anti-smoking ads for lung cancer. But there are a number of examples of prevention tactics that we can take when we talk about healthcare. And there's a reason why we should be spending this time and talking more about wellness and prevention as opposed to waiting until things get too far and having to treat diseases when they become so serious that surgeries are involved or multiple medications and long-term risk can happen. So my opinion is we need to focus more on wellness and preventative care, because if we do that, we can save patients, we can save individuals a lot of money in personal health care expenditures and save our healthcare system a lot in the long run. If we consider just two of the most serious diseases that have some of the highest morbidity and mortality in our country, diabetes and cerebrovascular, cardiovascular disease. When you think about what helps to prevent these things from happening, it's simple things that we can do every day, like exercise, eating the right diet, eating a better diet rather, protecting our cardiovascular health. So the goal again is to not wait until you've been diagnosed with diabetes. And I had a perfect example of this earlier this week where a patient came in with some numbness and tingling in his feet. And I always I did the test that I typically do for this and found that the patient had a peripheral neuropathy. Now, peripheral neuropathy is a nerve damage. It usually starts in the toes and works its way up. The number one reason for peripheral neuropathy in North America is diabetes. Other causes include like thyroid disease and alcohol consumption and different things like that. But I always screen people for B12 deficiencies and diabetes if it is a new diagnosis of neuropathy. Now, mind you, again, this patient came in to see me for numbness in his feet. Never been diagnosed with diabetes. I did the appropriate test, and he did screen positive for what's called impaired glucose tolerance or prediabetes. So in this case, if someone came in for a whole nother reason for neuropathy, and now based on the studies and the tests that we were able to do, found that he is at risk of developing full-blown diabetes, and even with impaired glucose tolerance or prediabetes, that in itself can cause serious complications like a peripheral neuropathy. But more important than that, I talk with this patient now about things that he can do to try to prevent the onset of full-blown diabetes. And these are things that you don't need an expensive gym membership. You don't need to go on a crazy diet. It's things like walking for exercise every day if you can, or at least 4 to 5 times a week, 30, 45 minutes of brisk walking, watching your diet, looking at diets that are low in carbohydrates and high fructose sugars and so forth. These small steps can then prevent you from getting diabetes and needing amputations and all of these things, eye disease, all these serious complications that can happen down the line. So let's consider another condition that I see quite often, and Alzheimer's disease. Over the past couple of years, we've had a number of new treatments that have come out to treat Alzheimer's disease. And the main goal of these drugs is to break up or eliminate these plaques within the brain called beta amyloid plaques that build up in the brain and can cause a lot of problems. Now, the thing is by the time that you have symptoms of Alzheimer's disease, which is primarily memory loss, these plaques have been forming for over 20 years prior to you having symptoms. So there's a large window of missed opportunity where we can address this and hopefully reduce a person's chances of developing Alzheimer's disease if we can address that. And whether that be through pharmacological means, but more importantly, through some non-pharmacological means. So Dr. Peter Attai, he talks about this in his book, Outlive, and really highlights some evidence that backs this up. There is a link or a risk of Alzheimer's disease with what's called metabolic syndrome. And with metabolic syndrome, you're talking about diabetes or impaired glucose tolerance, high visceral fat, cardiovascular risk factors like high blood pressure. All of these go into this thing that we call metabolic syndrome. And it's not just obesity. There are other things, other factors that go into the diagnosis of metabolic syndrome. But if you can decrease the amount of inflammation in your body through supplements or through meditation or through your diet, eating a fresh leafy green diet with antioxidants and so forth, that will reduce your risk of metabolic syndrome and thus decrease your chances of developing something like Alzheimer's disease. Improve your glucose metabolism, oxidative stress. So by improving your glucose metabolism, that could again be through diet, changing your diet, or increasing your exercise. I often recommend the patients to switch to a more Mediterranean type diet with the olive oil and fish that have the good type of fat, because there is bad fat and there's better or good type of fat, lipids. So some diets, such as Mediterranean diets, have found to help. Omega-3 free fatty acids or fish oils, supplements, hopefully achieve the same thing. So there's a lot of research that's now going on that's recognizing the link between diabetes or impaired glucose tolerance and cognitive decline, which could go on to lead to Alzheimer's disease. So I want to just give a couple of key things that you can do to help when it comes to preventative care for Alzheimer's disease. And a lot of these things I counsel my patients with, and even if you have even mild cognitive impairment or early Alzheimer's disease, these things can help to slow the progression as well. So increase physical exercise. You can increase your physical exercise in the form of walking or riding a stationary bike. These things improve your cardiovascular health. They improve the blood flow to your brain and your heart. So along with improving your overall health, it can also help to reduce your chances of developing Alzheimer's disease. The next thing is sleep. Sleep is when your brain repairs itself and rejuvenates. So if you don't get enough sleep, you place your brain at risk of these neurodegenerative disorders like Alzheimer's disease. Another thing that I don't think gets enough attention, but hearing loss. When you have hearing loss, you can become more withdrawn, or you may have issues with really paying attention. So that can make cognitive dysfunction worse if you have hearing problems. So get your hearing checked. If you do have some hearing loss, things like hearing aids can help and improve your attention, and hopefully serve as a preventative care measure to help reduce your chances of developing Alzheimer's disease as well. So let's talk about some general strategies that will improve your overall health and hopefully reduce the disease burden of some of these chronic diseases like diabetes or metabolic syndrome or hypertension or cardiovascular disease. Exercise. Study after study has shown the benefit of regular exercise. And you don't need an expensive gym membership. You don't need a personal trainer. So you certainly want to do things in a safe way. So depending on your age and overall health level, you want to do an exercise that's safe for you. But it can be as simple as just walking. Walking in the morning, walking in the evening. Walking does well and it's shown to be as beneficial as even running or jogging. So fast walking, brisk walking is an excellent way to get exercise in. The other thing I mentioned is stretching. Stretching is very good, and certainly things like yoga are all good stretch mechanisms as well. The second thing is make sure you manage your psychological health. Your body can sense if you're not doing well psychologically and if you give up, and it will give up itself. So if we address our psychological health, this will improve your overall physical health. It'll put you in the right mindset where you feel positively about yourself, where you want to make a positive change, whether it be through weight loss or changing your diet, those type of things. But you need to address your psyche first. You need to make sure that you're in a peaceful place and that you have the right mindset to improve your health set to move forward. And mental health is a big issue. There are a lot of stressors in the world nowadays. We have to find the things that work for, you have to find what works for you individually, whether again it be through like mindfulness meditation, exercise, stretching. All those things can help improve your psychological health. The other thing is diet and nutrition. This doesn't have to be like fad diets. It's simple things, intermittent fasting, monitoring your nutritional input. It's diet is as simple as ins and outs. If you take in more calories than you expend, then you're going to gain weight. So really looking at those things like macronutrients and trying to balance those things will really help you overall with your overall health. And lastly, sleep. Sleep is underrated. I come from a generation where you're supposed to be able to just push through. Who needs more than 3 hours of sleep? But we know now through science that having low sleep can be detrimental to your health. A lot of good things happen to your body, to your brain during sleep. Your body rejuvenates itself, it repairs, it replenishes. So sleep is very important. There are different studies have said different things about how much sleep is needed, whether it be 8 hours and 9 hours. But around in there is a good sweet spot as far as how much sleep you need. If you have trouble getting to sleep, make sure you practice good sleep hygiene, meaning don't have a lot of electronics in your room, TV, cell phones, and so forth in the bed, because that'll distract you and you can't mentally put yourself in your mentality into the position where it's ready to go to sleep. We need to pay more attention about our health and wellness and practice preventative measures that will help us prevent diseases and long-term effect of disease later on in the future. And it shouldn't or it doesn't always have to cost money or a lot of money, There are simple things that we can do in our daily lives, like increase exercise, managing our diet, and improving our sleep that'll have long-term effects on our health and our outcome. So I hope you've enjoyed this episode of Your Health, Your Wealth. Please subscribe and share, and we look forward to talking with you later in future editions.